Good morning, everybody. I'm Susan Neilan, and today we'll be talking about the importance and impact of adverse childhood experiences. So today we'll review the ACE study, look at its health impacts, specifically hone in on Northeast Ohio, and then really stress the importance to screen for trauma in all children. The ACE study, it comes from Felitti and Onda. The study was back in 1995 through 97. They were two internal medicine doctors who were running an obesity clinic, and they noted that there was about a 50% dropout rate in their patients. So they did a survey through Kaiser Health, almost 18,000 participants in the survey, looking at their childhood, their current health, and their behaviors. They also underwent a physical exam. And then so the adverse or ACEs that we see are abuse, neglect, and household challenges. So physical, emotional, sexual abuse, physical neglect, emotional neglect. And then if there is any mental illness in the home, domestic violence, divorce, an incarcerated relative, and any sort of substance abuse going on. Interestingly, back in 2008, no states across the US were collecting any sort of ACE data. Gradually, over the past few years, more and more states joined. And then currently, here in 2020, we can see that the good majority of every state is involved in looking at ACEs and collecting this data. And it looked like here in Ohio, Northeast Ohio specifically joined around 2019. We'll hear from Dr. Onda and Dr. Felitti. Whoops.
I think the most important thing that contributes to the information of the ACE study is simply the powerful nature of when people tell you the truth about their lives and you listen, you understand their life course.
It's made me realize how much of what we see in adult medicine is the result of what was present but not seen in pediatrics.
And then as we go through the presentation, I'll have different video clips just to recognize how difficult it is for patients to share and disclose. And there tends to be a lot of intimidation at times or threats to not tell anybody. And a quote from Maya Angelou says, "There is no greater agony than bearing an untold story inside of you."
My mother and my brother were murdered in front of me. He put the gun to my head and he had me beg for my life. I was 10. I just turned 10.
It's hard to come out and say that I was a victim and that I was abused, especially when you're little, because it's like a big secret that's always on your back and that you never know when it's going to come out.
The image of my brother falling on that concrete floor and people stepping and just kicking with shoes on his face, I couldn't get that image out of my head.
And then returning back to the ACEs, the survey that they had performed included these specific questions. So looking at during the first 18 years of your life, did you undergo any emotional abuse, physical abuse, sexual abuse?
It all started off with a hugging game. He would take us into his room. We would sit on his lap and he would hug us, and we weren't supposed to tell anyone.
When I was 5, I would have to leave kindergarten class and go home and have sex with this man who was in his 50s. I remember the long walk home and crying and falling down and having to get back up and walking on.
And then next, looking into neglect, emotional neglect and physical neglect. In this survey, this was only the second wave, so almost around 9,000 participants in this area. Again, looking at domestic violence, substance abuse, household mental illness, divorce, an incarcerated household member.
I started hearing my mom scream in the middle of the night. And it got to the point where he started like beating me and my sisters. I let my anger build up, didn't talk to anybody about it.
When you hold everything aside, it's like a bomb and it's like you're ready to explode and just somebody push that last button.
And so one part of the data that they found was the more often you were exposed to domestic violence within your family, the more likely you too were exposed to emotional, physical, and sexual abuse. So the correlation was together. The more often for the domestic violence, the more often they themselves were experiencing abuse in all categories.
My dad started like actually physically beating me to the point to where I go to school with covered in bruises. I don't know how many times I've been threatened to be killed by my own dad.
My brother got shot in the head. He didn't make it.
It makes you afraid at times. It makes you feel that, oh my God, you know what? I just lost a friend. I just lost a family member. It just makes you feel that, hey, I could die next. I could be the next one dead.
And so overall, the results show that the more ACEs that you have, the higher risk you are for negative health outcomes. The ACE study showed that at least 64% of those had at least one ACE. So what does that mean? The study's findings showed that an ACE score of 4 and above, they were 2 times more likely to be smokers, 12 times more likely to have attempted suicide, 7 times more likely to be an alcoholic, 10 times more likely to have injected street drugs. An ACE score of 7 and above increased the likelihood of childhood or adolescent suicide attempts by 51 times and adult suicide attempts by 30 times.
I felt isolated. Nobody knew what I was going through. To go 3 years without talking about it, I imploded.
Finally, after like stressing and keeping everything bottled up and everything building up, I just finally broke down one day and attempted suicide.
Looking at the different category of the ACEs, here we can see that those that underwent emotional abuse had the highest risk of attempting suicide, and that this roughly correlates to about a 5-time risk. And then throughout the others, you can see that they are all elevated as well. ACEs overall too, they noted the health impact. So there was an increased risk for TBIs, fractures, burns, affecting mental health, depression, anxiety, as we saw the suicide rates, maternal health, more so with unintended pregnancy, potentially pregnancy complications, fetal death, increased risk for STDs, increased risk for cancer, diabetes, as well as alcoholism, drug use, unsafe sex, and diminish their opportunity regarding education, occupation, and income. Here is a really interesting picture. So what the percentages mean that if this person had an ACE score of 0, how would that impact them? So they essentially state that depression would decrease by 44%. These other illnesses would decrease by this amount. So looking at smoking and drinking, as well as the social area too here, we can see that it's very significant. The biggest one that really is stunning is that people with 6 or more ACEs died nearly 20 years earlier on average than those without any ACEs. And so truly, in my beginning is my end. Other groups were more likely to have experienced ACEs as well. So different research studies show that Black, Hispanic, or Latino or multiracial people with less than a high school education, people making less than $15,000 per year, people who are unemployed or unable to work, and the LGBTQ population. In general, toxic stress can affect your entire body, so your organs, your tissue, your brain development, and really impact your ability to process information, make decisions, interact with others, emotion regulation. And as we kind of see with this image, it's stunning to see that as this person is growing older, that she still kind of keeps that shadow of a little child, a little girl.
I get really mad when my brother hits me a lot. I don't like it when you say you don't want to play with me.
When I'm mad, my brain can get a headache and it can start hurting.
Your blood keeps pumping because you're like really mad. And you start to get sweaty because you're getting really, really mad. And then when you start getting really mad, you turn red. When your body can't really control yourself, mad just takes over your body. I just get out of control. It's kind of like if you had a jar, and then the jar would be your brain, and then you put glitter in the jar, and that would be how you would feel. If you shook up the jar and the glitter went everywhere, that would be how your mind looks. And it's like spinning around, and then you don't have any time to think. And you sometimes punch stuff and people when you don't really mean it. When I get angry, I feel it in my heart. I really don't like when I get angry. The amygdala really reacts, but the prefrontal cortex tries to keep it down.
And so she gives a nice transition into just looking again at your body and your brain. That toxic stress tends to release the fight and flight hormones like cortisol. And here's an image showing an EEG of the resting state of a control and a patient with PTSD. And so at baseline, at rest, you can see how significant they are already activated. They're on edge. They're literally in survival mode. Here, this looks at brain activity in children that have been institutionalized versus one that was never institutionalized. And that orange and that red indicates more activity, more brain activity. And we can see that the comparison as we go throughout to essentially that there's no brain activity in different areas of these children. This also demonstrates a PET scan of the brain. The left side here is a normal child. They hone in on the temporal lobes area where early childhood experiences tend to make this connection. And so on the right side, this is a PET scan of a brain of a Romanian orphan who was institutionalized after birth and underwent neglect and deprivation. And here we can see that there's almost complete blackness. There's no connections that are evident. Here in the US, we actually have one of the worst records among industrialized nations, losing potentially on average 4 to 7 children every day to child abuse and neglect. And then these numbers in itself, they are likely to be underestimated of those children just due to underreporting or kiddos that are slipping through the cracks. So focusing in on our area, what's going on here in Northeast Ohio? In 2021, we had roughly 25,000 kids in foster care. Looking at Ohio specifically, we can see that, we are one of the greatest areas impacted in Ohio as well. And so Cuyahoga County had almost 4,000 kiddos, Summit County around 1,500, and then Stark was a little over 600 as well. A report of child abuse is made every 10 seconds. And so as I was gathering research for this presentation, this really shocked me. So this data comes from Children's Services across the nation, the Children's Bureau in 2020. And so all of the counties in red, there's 28 counties across the nation, they had more than 15,000 screened in cases of child abuse from ages 0 to 17. And what that means is that these counties represent 20% of all the cases across the nation of any reports here. And so we can see Cleveland, Northeastern Ohio areas highlighted, as well as more south down towards Columbus. Honing in on our area specifically, we can see the data. Cuyahoga County was number 1. Number 2 was actually Lorain County, or number 2 was Summit County, and number 3 was Lorain County. Looking specifically at children with depression and anxiety, Ohio is still pretty moderate compared to the nation. And we had roughly about 250,000 kiddos suffering with depression and anxiety over the last few years. Looking at statistics in 2020. And so these were looking specifically at all races of males only. These are the age ranges here for 10 to 14. In 2020, there were 22 suicides. Those between 15 to 19, there were 46. And from 20 to 24, 120. And this really hones in on the point that teenage males are very, very high risk for suicide. The opposite, I'm looking at females of all races in 2020. We first noticed suicides in the 15 to 19 age range, and then between 20 to 24, 37 suicides. What about finances? So looking at children in poverty, Mahoning County had almost 30% of kiddos in poverty. Going down, we can see roughly between 15 to 30% in our area in 2021. And what does that exactly correlate to? So just looking at the guidelines for 2021, a 4-person household, the poverty guideline was 26,000. For data across 2022, households with children where children were not eating enough due to food being unaffordable, anywhere between the lowest is 18% up to 33%. Here, it hones in on the different school districts. So we can see Cleveland is in this area, Akron is down around here, and then Trumbull County, Mahoning County, Warren, Youngstown is in this area. And so we're all different areas that are struggling with poverty. What about graduation? In 2022, roughly 87% of students graduate high school in 4 years. The latest data that I could find was from 2016, showing that Cuyahoga County was struggling, and then roughly comparing to the 87%, these were pretty close.
My mother, she knew that stuff was going on, but it just seemed like she didn't really care. She never stopped that abuse. And to this day, I've never forgotten what some of my family members have done to me.
And so it really is important to routinely question regarding trauma, abuse, any sort of PTSD symptoms, even if that's not the reason for the referral. Treatment just in general, we look at trauma-focused therapy that has the most data for the treatment of childhood PTSD. There's also group CBT protocols, and then Seeking Safety is a manual related to PTSD as well as with substance abuse. Looking at trauma-focused CBT skills, helping kiddos walk through and learning how to work through it with these areas has been helpful. Other therapies, play therapy, art therapy, animal therapy. Medications can be an option as well. And then the ultimate would be prevention. So the National Center for Injury Prevention and Control of Adverse Childhood Experiences Prevention Strategy. Recently, just in 2020, the CDC is going to be providing funding for ACEs and how to prevent them. Their focus is on these 6 areas. So strengthening economic support to family, promoting social norms to protect against violence and adversity, ensuring a strong start for children, teaching skills, connecting youth to caring adults and activities, intervening to lessen immediate and long-term harms. And so just like there's always time for pain, there's always time for healing. Thank you so much for listening.